illness, disease, healing, the motivation has to be intrinsic. It can't be someone telling you, you need to do this, you need to fix this, you need to be better. We meditate to bring out our wisdom and compassion and tap into our innate qualities that we already have, but we forget about. And once we taste those, it's hard to forget that. And here's the message of,
I am so thrilled to see you and learn about all the great work you do because you're a medical anthropologist. You do a lot of work with mindfulness, coaching, and I don't feel like I can name everything you do. Can you tell us a little bit about yourself and the transformative work that you're doing in the world?
yes, I can. And I just first want to say thank you for the invitation. And I'm very honored and excited to be sharing a little bit about myself and my work with your audience. So thank you for that.
Mhm.
Yes, I am a medical anthropologist. Long ago, tapped into a passion for really understanding how cultures do health and healing. We know that our own culture, wherever we live, we're not the only ones that approach dealing with health, illness, disease, healing. We recognize that there's traditions and histories that go way back, and a lot of wisdom there. And so I was really interested in understanding a little bit more about cross-cultural perspectives. So I began that journey, and it really led me to working with community. I began my career actually working in Mexico and understanding how women were organizing themselves and bringing global healing traditions into a traditional medical kind of context in Mexico. But soon decided that I really wanted to see how I could apply the kind of practices and approaches of anthropology in communities in the United States where I was living. And so I, for the last about 23 years, have been working in community health spaces and working on projects that really try to engage communities in different areas of whatever public health areas are important to them. And that's kind of where I've landed. And along the way, of course, I started my career observing people because that's what anthropologists do. They observe other cultures and practices and try to understand belief systems. And I felt like I needed to balance my life by not just observing practices, but doing practices. And interestingly enough, when I was in Mexico as a young researcher, I ended up with the women that I was working with and studying for a year while I was living there, brought a meditation teacher into the community center that they were working out of. And they invited me to a week-long retreat in which I knew very little about what that could possibly mean. And of course, when they said, come meditate with us for a week, I was like, I don't think I have time. I'm a busy person. And I decided to join them. And I spent a week um, really noticing my own emotions, noticing how I operated, really taking a look at the anxiety that I was carrying. I was, highly anxious in those moments of my life. And it was really transformative for me to be part of an experience where I had dedicated time to follow my breath and to bring awareness to what was happening in my moments and to sense a community over the course of this week, listening to these women break out in songs in Spanish, of course, and hearing the joy that was coming up because they too were stopping and listening to themselves in a new and different kind of way. It was a very transformative experience for me. And I went home. I lived in Michigan at that time, and I found a Sangha, a meditation group to join, and really began studying at that point and practicing. I have since been practicing meditation for 22 years and found that, again, I didn't want to just be an observer in the world. I wanted to be a practitioner. So I've practiced and studied and trained, and I completed a mindfulness teacher training program with Jack Kornfield and Tara Brach, which was also transformative. And it really aided in just having clear sense of what it is to be a mindfulness teacher in our country right now. And I've been teaching mindfulness for over 12 years. And I've been really lucky to be able to merge the mindfulness teacher and training with the community health work that I've been doing as well, because I see myself first as an educator now. And so I can bring that kind of education and really experiential education into the community and the populations that I've been working with. So that was kind of a long version, but the journey's been interesting and circuitous.
Yeah, it's funny. We always expect a linear journey, and it never is that,
No,
right?
no,
And what I hear from you as the scholar practitioner,
yeah,
so many people I hear all the time, especially in my classes, they're like, I don't have time to meditate, Suchandra. I don't have time. And I
yeah,
say, okay, just 1 minute a day. And they're like, I don't have time. But yet,
yeah,
how do we have time for scrolling through Instagram or, whatever other social media there is? So I'm
yes.
curious to how do people get over that hurdle, over that the mind of excuses that haunt us?
That's such an interesting question. I was asked that question. I taught an hour-long class on working with the nervous system. We get through this class and everyone's really settled and calm. We did practices. And the last question I got was a woman who said, but how do I even start? How do I even start? Right. And it's the $1 million question. I will never say that I have the answer because I know how individual it is to be able to start a practice and maintain a practice. And just like you, I truly believe that it is that, if it's anything, it's 1 minute a day or it's 5 minutes a day. But I also know that we get to a point in our lives where we're not feeling good. And I don't mean like physically sometimes. I mean, we know when we're burnt out, when we're exhausted, when our adrenals are burnt out, when, we're really pushing the boundaries of feeling like ourselves. And I know that with all the resources just swirling around in our culture, and it is so easy to find resources that and teachers and groups and classes that you meet that teacher at the right time or you find that class at the right time. And finding the motivation has to be intrinsic. It can't be someone telling you, you need to do this, you need to fix this, you need to be better. And that is not why we meditate in the first place. As you know, we meditate, to bring out our wisdom and compassion and tap into our innate qualities that we already have, but we forget about. And once we taste those, like in a class, in a single class, or if you end up in a meditation group, once you taste that, it's hard to forget that. And I think that oftentimes is the hook that someone encounters someone, has a conversation, has an experience, goes to a class. And here's the message of perfection isn't the goal here. It is a little bit, but every single day, because that commitment is so critically important, and recognizing how hard that is too. It's just not as easy to say, give up scrolling for 10 minutes a day and replace it with 10 minutes of mindful breathing. It doesn't work like that. We do have to really ensure that we are in that place where we're committed and we're ready to take care of ourselves and we prioritize ourselves.
My master, she always said to me, especially in the beginning, she said, practice is not perfection. Practice makes practice.
Yes, that is so beautiful.
So, how are you implementing programs across the country? I mean, you're starting these programs, you're implementing them, and mindfulness in the West is oftentimes categorized as a self-help tool. But what I hear you saying is similar to what I tell people that that's not what it is.
Yeah, I am trying to work against that grain, and trying to reach as many people as I can, just with a clearer message about what mindfulness is. I happen to, currently work in a university that's a land grant university, and we have land grant universities in every single state. Mine is Colorado State University. Within land grant universities, we have what are called extension systems, and it means that there's a network of county offices. Every single county in our country, people don't realize this, have extension county offices, and they're staffed with at least one person who is there to meet community needs. And so I am part of this system in Colorado. I'm our state health specialist. And so I have the benefit of having conversations not only with people across our state who deliver programs across the state, but also on a national level, because we're organized nationally, and can share resources, programs, information nationally through these systems that are across our country. I brought my passion for mindfulness 10 years ago to the organization when I was working in one of the county offices, and was kind of surprised that there was acceptance of mindfulness 10 years ago through a university system, but through that, disseminates information and research-based education into communities. And there was a desire for this, and so I went where the energy was. I was invited to health systems, I was invited to senior centers, I was invited to women's associations and clubs and groups to teach about wellness and self-care, and sometimes explicitly mindfulness. Well, I never miss an opportunity to bring a practice into anything that I'm teaching. And so through all of these opportunities, I just really was able to, and sometimes I didn't even talk about it in terms of mindfulness, but let's just sit and feel the connection of our feet on the floor. What does that feel like for this minute? Or what happens when you start to feel the anxiety or the thinking get strong? Just, do you notice what happens in your body? And slowly over time, this became more and more accepted. I developed an online program. It was called Living Mindfully when I developed it probably 8 years ago. And that was an opportunity to really get some of those teachings out a lot more widely, beyond just where I was teaching in this county or beyond even just the state. And again, it was surprising to me because the university system was able to embrace this. We have a center for mindfulness, and there is a lot that's being offered to students in the university. We see this across the country. But my work was more community based, and really I had to feel my way through what was ready to be taught and who was ready to be taught. And when I say taught, I mean remembering. Again, I'm going to come back to the definition of mindfulness, of remembering, because people don't need to be taught. They need to remember. They need to feel what it's like to just get a little bit more present and notice, what's coming up for them, or feeling what it feels like to breathe again and be able to settle their nervous system. So it's been an interesting journey for me, and I'm really just beginning with it, because I am really curious about how we adapt our teaching for new eras and new populations, because it doesn't have to be traditional Buddhism that might scare people away, while the foundations of our mindfulness teaching, of course, have their roots and their traditions and their practices. We know where they come from. Bringing secular mindfulness into communities feels really important to me, and I'm curious about merging some of those practices with other religious backgrounds and trainings and belief systems as well. And how can we just find our path where we are paying more attention to what's going on inside of us, and less attention to all of that energy that's just exploding around us, especially these days.
I love that you mentioned the word remembering, Sati. So we just had recently a program on the psychology of mindfulness, and we're about to launch it again. And one participant said to me, "So Chandra, I need to learn how to be calm because all I know is chaos. And she said that's her true nature. And
Mm.
and I was like, wow, a lot of people actually, that's what they think their true nature is. But we know that's not their true nature. That's the conditioning, right? That's like what society said you have to be without saying it directly.
Oh,
What
yeah.
would you say to that?
Yeah. Wow, I mean, that just sent chills up my spine because it's, the big misunderstanding of our own being. I actually refer a lot to internal family systems because internal family systems really has been able to bring about in very Western language, in the language of psychology, that we have a self. And this is the same as Buddha nature. This is the same as this inherent wholeness, but we have a self that has these qualities of caring and compassion and courage and these things that are solid and they don't change within us, and that everything that gets in the way of this solid, Buddha nature is parts. They're parts that were formed when we were young and we were trying to protect ourselves, or we had to hide from the scary things. And these are just parts, and they cover up the sun. Sometimes we can think about that central, core self as a sun, and they cover up the sun and they make it cloudy. And sometimes you don't realize there's the sun still in there, but it is always in there. And it is so useful to help people shift their perspective of I am the part. This is the chaos is a part, right? It's a protective part, it's a scared part, whatever it is. But shift that thinking and say, no, that's a part. And if you give that part a little bit of attention, because it's kind of asking for that rather than like, being afraid of it and pushing it away. If you give it some attention, it might soften and relax a little bit. And you might see the sun a little bit stronger, the self, the Buddha nature a little bit stronger. And it is really relieving for people to understand that, what they have is exactly what they need. And what they are afraid they don't have is always there for them. It requires us to slow down. If we believe we are the chaos, but we can't see the chaos is just going to get bigger and bigger. So recognizing that we need that self-awareness, but also recognizing that, boy, we really need the self-compassion to go along with that, because this is hard. Being human is super hard, and living in these times, I haven't lived in other times, but I might assume from elders I have spoken with that these times are pretty tricky, and they do require a lot of care. We have to slow down to give ourselves that care and even recognize what this brightness we have inside of us is. That's what I would say if I had a while to say it. But I do think it's so important for people to recognize they think they're the busy mind, they think they're the anxiety, they think they're depression, and these are just parts that are taking care of us, and we can love them too, but we can let them, be released into a larger space of love that we can hold all of it. But that's not who we are. We're not the anxiety or the chaos or the depression.
And
I think we have to learn that.
a lot of people are fragmented into parts right now.
A lot of parts. Yeah.
What would IFS say a practice could be for someone who maybe cannot go to a therapist, or maybe someone who's not even familiar with IFS in general, or familiar with psychology or emotional regulation, even?
Yeah. Yeah, a simple practice. I mean, we start with the grounding. We have to start with the grounding because if we can't settle our bodies, we can't even notice what's in our bodies. And so, any kind of grounding practice where we can pay attention to our breathing, where we can feel the sensations in our hands or our feet, is really the starting point. And there are a million paths from there. And of course, it's wonderful to be guided in these practices, whether it's a guided meditation, an audio, or an actual trained trained coach or therapist, and there's a lot of IFS training out there, and a lot of people who are gaining some of these skills. But really, what it is somatic awareness. It's noticing what's happening in the body, and then saying, what's coming up for you with that. How old is that part? Wherever you feel it. What does that part want you to know? What's happening now, internally in your body, and regrounding, with the sensations of the calm and the relaxation, and just returning when people start talking about things like, I do feel calm, or I feel courage, or I'm starting to get some clarity. We know that they're starting to tap into that, more spacious, central, grounded place. And you can feel it when a shift happens, and bringing just a little bit of love to whatever somatic experience, or if you can name a part, just bringing some compassion to that, and seeing if you can return back to the heart space and notice if there's more clarity or calm.
Beautiful. So, can we return back to medical anthropology? What is that? How does this relate?
Oh, how does this relate? Yeah, it's interesting. Medical anthropology anthropology is the descriptive documentation of culture, of living cultures. And anthropologists tend to spend a period of time, observing, behaviors, practices, belief systems, whatever, within cultures, embed themselves, and really try to understand the, larger picture of different perspectives. In terms of medical anthropology, it might be healing traditions, or different health practices. There's public health anthropology. There's observing medical systems and decoding, what those behaviors are. The way I kind of understand this is, meditation is a very longstanding traditional practice, many practices. And these practices are not devoid of their cultural context. In the West, we do secularize a lot, and I am advocating for a lot of secular teaching, because I do want to reach people where they are in the West. But at the same time, we stay true to, the traditions behind these practices and where they've come from and why. And so I think it's all linked together. It's just, it's one version of a practice that has a lot of different roots and a lot of different stories behind it. And I'm just fascinated with seeing how global healing traditions find their ways in different eras and different communities and countries.
A lot of people would say we've grown away from true healing. Now we're just providing symptom relief, really, in the Eurocentric view, right? So yeah, go ahead.
Yeah, no, I think that's the legacy of Western culture. And I think many people have inherited the mentality that we depend on our formally trained professionals, our health providers, our physicians, to fix our problems. And now we're relying on drugs and medications. And I would never dismiss Western medicine. It saves lives, it makes people healthy. We have clear awareness about what vaccines do. But I will say that dependency has moved us away from our innate knowledge, our innate understanding of what we might need to do also to be well. And we have to use discernment, of course, when we make decisions between relying on a professional that can help us, which oftentimes we need, and giving ourselves some space to walk a path of healing that is oftentimes much deeper than the physical body. the healing that happens on a deep spiritual level, the healing that happens on an emotional level. We even talk about, people who are going through the dying process can heal. And that's counterintuitive to Western medicine, right? But even those who are being released of their body can go through a healing process. And it is so much deeper than we even know what happens. There's so many different healing traditions, and sometimes we rely on plants, and sometimes we rely on things like needles through acupuncture and different meridians, and Ayurveda systems have different kinds of herbs and healing approaches. There are umpteen different healing traditions that have all been garnered through ages and ages of wisdom, and we can't discount all of that wisdom, but we don't have a lot of that wisdom in our own culture unless we have, grandmothers who have cultivated their herb gardens over, from their grandparents and their grandparents per se. And even in our culture that would have happened. But Western culture just has developed in a way that's largely devoid of a really strong kind of cultural healing tradition. And I just think there's a lot to learn. We have to find our way in it, but we also inherently have to learn how to listen to ourselves a little bit more too.
And this sounds like exactly where meditation comes in, doesn't it? Like we have to have clarity of mind, not the subliminal messages we're fed over and over and over again.
Yeah. And I hear this question a lot about how do I trust my instincts versus, the subliminal messages? Like, how do I know what's true, right? And I think that's part of where a lot of us are in this culture, just being inculcated with messages and fear messages and all of that. How do we know what's true? And I truly believe the way to get there, and this could take a lifetime or many, many lifetimes, but the way to get there is through our meditation practice and becoming, clear minded, and aware, like deeply aware. And then we will have a better shot at knowing, you know, if we can, of course, trust ourselves. We can, of course, trust ourselves, but is it a message from the outside or is it a message from inside? There's no substitution for stopping. There's no substitution for silence and for settling and for connecting with our breath and and I believe for going on retreat, even if it's for small periods of time. I retreat is not a Western concept here because that means you have to stop what you're doing and do nothing, right, on retreat. But the benefit is so magnificent. And so few people would stop for 5 hours, 8 hours, 3 days, a week, a month, and literally let their systems detox and clear out through the simplicity of following the breath. And it seems so outrageous to so many people. And I can't think of a more powerful tool for becoming, connected with those internal messages.
How do you translate this to the university system? I mean, if we're being honest, if we're being
Yes.
completely honest, right? There's so much toxicity there.
Yeah. Yeah. I don't try to translate it to the university system.
I
I
love
try to
that.
translate it to individuals who are open. I have just been shocked at how many people show up to classes, and I don't expect a whole lot to happen, and a whole lot happens. And it is really one by one by one. And I think for me, maybe the way I influence the system is by being successful and getting people to my classes and being invited to give presentations and talks and sticking with it and writing a book and on my free time because it wasn't part of my job description, right? And I think that by people showing up, systems can begin to understand there's value. there's also a cultural wave right now where universities, workplaces are saying there is burnout, we have mental health problems, and our the quality of our work is decreasing, or the quantity of our work. We're not as productive because of these issues. And therefore there are tools out there, right? And of course mindfulness has been popularized, and we know that's a tool. And in some cases it's really good, because in some cases workplaces, university systems, whatever, medical systems are investing in the right kind of mindfulness, trained professionals who can bring mindfulness in a very concrete way into these systems. Other times it's looking more like grab and go, let's put somebody on an app for 15 minutes, or let's, just do a 5-minute virtual jump in centering experience, right? And it's not sustainable, and there's not a goal for how we want to institute this, across an institution. I'm seeing both sides of it. Some of it's very encouraging, and some of it, needs a little bit of support. But I think very slowly we need to just bring our passion and be well in our own workplaces, and be well in our own work, and be role models of that. And it's a slow process. On one hand, mindfulness is being popularized so fast that there's just some stuff out there that's just not so helpful. And on the other hand, because people know about mindfulness, they might find some great resources and really dig in a little bit more deeply. So it's always that balance.
Yeah, it's weighing the pros and cons, right?
Yeah.
Popularity means there's going to be dilution, and I would say delusion as
Yeah,
well.
yeah, absolutely.
Um, I'm curious. One thing you said earlier really struck me, Sam. You said healing in the dying process.
Mm,
Can you say more about that? What does that
mm.
mean?
Yeah. There's a difference in anthropology between sickness and illness, and that a healing process can be alone. We can do healing by ourselves, or the we in wellness, we can do healing together. Um, there's a component of connection in healing, and this can go for when we're aging and we're dying, and we are able to reconnect and find things that we may have left behind in our lives, or just strengthen the spirit within us because of what's important to us. And that's healing together. But the other part of it is that it's very possible that we can live lives that we don't feel like we have tapped in to our source strongly enough, or had connection with our spirits, our souls, whatever the languages we choose to use. And that for some people, when you release the habits, and you release the conditioning, and you release the pain and the expectations, and you surrender into it, there is a deeper connection with spirit, soul, whatever it is that may have been missing in someone's lives. And so, how can you not argue that you could end up whole in the dying process, or once someone dies, if they are able to touch into the larger forces that exist around them? There's a lot about this. I don't know personally, but I do know that, people that have diseases, terminal illnesses, um, it can be a space of dropping what doesn't serve them. And that even if the illness continues to be terminal, if they do indeed die, many people could argue that their loved ones were healed in this life of the pain, of the suffering, of the disconnect from larger connections.
I think of myself, when I was a child, I was diagnosed with a terminal illness,
Mm.
and they told me that I would probably not make it past 21.
Oh my
Here I
gosh.
am now in my mid 30s. And
Wow.
I really associate so much healing to meditation practice, and especially for me after I met my master and took ordination, all those symptoms I had just went away, and I feel happy. I feel peaceful, my body and my mind. And so I have experienced this firsthand, not in the dying process, but the healing.
Yeah. Yeah. And you've tapped into something really, really powerful. And it is so beautiful. And I mean, there are so many beautiful stories out there um, that are so inspirational here. And I will say, it's not always the case. It doesn't always happen like that. And it doesn't mean that someone is not, you know,
Doing the
powerful or connected. It's that our stories can be very different. And you have clearly found your passion and your calling and all
And
the.
so have you, right? That's what you're doing. You're really transforming communities. I mean, I can't wait to go all the way to Fort Collins and just see you and see the work you're doing directly also.
Yeah, thank you.
So we have a ritual here with Chung Huong Institute. The previous guest asks a question for the next one. So you have a question
Okay.
from a psychotherapist. This question is, I'm going to read it.
Okay.
How come it seems like anthropologists can get into any subfield? Many become scientists and others go into other places. Can you please tell us about that and the impact your work has had on you?
Hmm. Well, I would say the answer is because culture is everywhere. Anything around us is built on culture, whether it is a science lab, imagine culture in that lab, or forestry service, and the culture that is held traditionally within the forestry service. And anthropologists can go in there and unravel truths, unravel realities, unravel belief systems, or even what's holding people back and how to help people move forward if they bring their eyes of observation and really very neutral observation to help people just understand themselves a little bit better. So that's a value of anthropology. I guess I continue to see the world from that lens. I see people from the lens of culture because I see people from where they are. Everyone has their own story, and we're little mini cultures within ourselves, of course, inherited from our families and all of that cultural background. But I do love my work with individuals, and I never approach an individual as the same as somehow they're going to be generic characteristics. And I love to just be in relationship from that place because there's so much to learn from people and so much to share. And I'll just say one more thing is that, our meditation practice, I think, brings that out because we can begin to see much more clearly who we are, that microcosm of ourselves, and all of those cultural holdings within us that are all of those the conditioning that we're holding on to. But the anthropology within is fascinating. The observation within is super fascinating, as well as the observation outside.
What exactly is the anthropology within?
I guess that's mindfulness. Yeah,
I love that.
yeah.
Thank you so much, Sue, for being here with us today
Well,
and your
thank
time.
you so much. I appreciate it. It was fun chatting.